Hello, my name is Joyce Young, and I'm a pharmacist here at Kaiser Santa Rosa. I would like to briefly discuss the medications we use to sedate ventilated patients. First, we have a morphine drip. As you know, morphine is used commonly as an analgesic and has sedative properties. It works by binding to the opioid receptors in the central nervous system to block pain. It has a duration of 12 to 24 hours and has a sympathetic relationship to benzodiazepines. Because it also depresses the CNS, blood pressure and respiratory drive should be closely monitored. Next, we have propofol. Propofol is a sedative hypnotic agent and is very short-acting unless it has been on for several days. In the short term, it wears off quickly, usually within 3 to 10 minutes. It does not have analgesic properties per se, but does suppress the CNS, thus inhibiting a visible response to pain. If the drip has been on for a week or more, the duration lasts longer, and the patient may appear groggy and confused for a while after turning it off. Like morphine, the CNS, blood pressure, and respiratory rate should be closely monitored. Now onto the benzodiazepines. Benzodiazepines, such as Versed or Ativan, affect the receptors in the CNS and enhance GABA effects with amnesic properties. They are classified as anesthetics and are sympathetic to morphine and propofol, which may make the effect last longer than the usual 30 to 80 minutes after ending the drip. Benzodiazepines can severely depress the respiratory drive, which should be closely monitored. Finally, we have Precedex. Precedex is a selective alpha-2 adrenal receptor agonist and has anesthetic, sedative, amnesic, and analgesic properties. The effects last anywhere from 1 to 2 hours and is not intended to run as a drip for more than 24 hours. Like the other sedatives, blood pressure, respiratory rate, and oxygenation must be closely monitored. Now, here are some take-home points. Monitor vital signs closely when inducing or removing sedation. When weaning per the sedation vacation protocol, decrease the sedation if the patient passes. Stop it for the ventilator weaning trial. If the patient fails the ventilator weaning trial, restart sedation at 50 to 75% the original dose. Patient may remain groggy for a while if the drip has been on for an extended period. If the patient is on a paralytic drug, that must be stopped before decreasing or stopping the sedatives. Thank you for your attention, and I hope this information will help you better understand the pharmacy aspect of the sedation vacation protocol.